You are listening to part 96 of our series, 7 Medicines, The Wise Woman Way with Susan Weed at Time Monk Radio. Hello, Susan, and welcome back to Time Monk Radio.
Hi, Gemini. As always, it is just a delight to be here with you. I hope I wasn't sounding too grim last week there about the surgery and the complications and what can happen. But I do find that it's often approached without the realization of how dangerous this particular medicine can be.
No, you weren't too grim. Sorry to hear about your friend. And, it is risky medicine. Absolutely.
It was not unexpected by her. Actually, before she went for the surgery, she said, when I die, I want this. And I'm like, you're not going to die. And she had her will, she had everything, all that. She said, I am going to die because, I gave up drinking alcohol. She was an alcoholic, and she gave up drinking alcohol. And then she gave up cigarettes. She said, and my reward for giving up alcohol and cigarettes was a brain aneurysm. She said, so I think it's pretty clear what's in store for me, and that is that I'm graduating to whatever comes next.
Well, that's a healthy attitude.
Yeah. Yeah, and of course we all kind of poo-pooed it and said, oh, no.
Sure.
It's just as simple. And again, remember these catheters, they're not even doing full anesthesia. But she left specific instructions. She said, if I do not come out of this then I'm not coming out of it. You're not going to keep me as a vegetable.
Right.
And she signed all the do not resuscitate orders. It was pretty clear what she wanted. And what she didn't want was post-traumatic stress. Wow. People say that the intensive care unit is a really good place to catch post-traumatic stress, or being treated for a heart attack, or being treated for cancer. And what I didn't know is that post-traumatic stress can strike weeks or even years after the event. I have had my own personal run-ins with post-traumatic stress, in that I was in a situation in New York City where the apartment that I was living in was broken into by a huge group of police. And I mean broken into. They broke through the doors and they broke through the windows, and I was wakened up out of a sound sleep. I thought I was in the middle of a war. And just last week, I walked into a room in my house, and I didn't realize that my sweetheart had a radio on very, very low. He was listening to the playoffs of the baseball games. And I thought it was police outside the house with walkie-talkies. And I could feel, that whole, post-traumatic stress just bam, reach out and grab me. And, the event we're talking about occurred almost 50 years ago. And I hardly ever think of it. It's certainly not part of my day-to-day life. And yet this sound that must have been part of the sound that woke me up was able to just trigger that. So the fact that you get out of the hospital okay doesn't mean that PTSD can't strike you. And you get scared. My heart was racing. And it can get worse. You can go numb. You can have nightmares. And in fact, post-traumatic stress disorder doesn't get better on its own. It can get worse and worse because the nightmares and the flashbacks can increase that. Now, one of the things that we are finding is that we can change this to post-traumatic stress discovery, and that we need to offer people opportunities to really change themselves, and that this has helped a great many people. Cognitive behavioral therapy is also very useful. Prolonged exposure therapy has been used. Hypnosis, usually 4 to 16 sessions, has had some amazing result with people with PTSD. Also, eye movement desensitization and reprocessing. How's that for a mouthful? And of course, it's shortened to EMDR, eye movement desensitization and reprocessing. And you will be asked to perform certain eye movements while talking about the trauma. Then you perform the same eye movement while focusing on a positive memory. Then, if you start to have the bad memory, you can use the same focus, and that will call up the good memory. It has been approved as a treatment by the U.S. Department of Defense, and you can find them at emdria.org. E as in I, M as in movement, D as in desensitization, R as in reprocessing, I as in international, A as in association, EMDRIA.org. The selective serotonin reuptake inhibitors can help with PTSD, but I don't like to see people go there. I would much rather see them do all of these other things first. But if you need it, and reach out for it. Support groups have been really useful. In fact, some people say that therapy is really just a kind of one-on-one support group. I remember there's a really exquisite story told by an herbalist who was working at her clinic, and the patient was a person that she didn't realize had PTSD, but had some physical complaints, and they were talking about those physical complaints. And she asked the question that at this particular school they are taught to ask, what happened just before these problems? And he began to talk about his time in war and what had happened to him. And she said, I sat there and listened to him for 2 hours talk about his experiences of being shot at and shooting at people and bombs going off. And at the end of that time, as he wiped his tears away because he was crying, he looked at her and he said, I have never told anyone what I have told you. And then there was a long pause, and he looked at her and he said, you know, I'm not sure I have any of those problems anymore. I think I feel pretty good now. And that's why it was such an exquisite story. A support group doesn't have to do anything to support you except open their ears and open their hearts and hear your story. We're certainly not saying that the PTSD can be completely cured by telling your story. We're not being Pollyanna-ish. But many times telling the story is a fabulous first step that can help us move through that post-traumatic step. Most intensive care patients are receiving life-saving care, but let's face it, they're high-intensity settings. There's constant noise, there's bright lights, and this is trauma. 25% of those who are admitted to an intensive care unit have symptoms of post-traumatic stress afterwards. 25%. Remember, a couple of weeks ago, I was saying your body's traumatized by the surgery. You let strangers cut on it. This is even greater if you go into intensive care. Intensive care patients don't have flashbacks about actual events. They have hallucinations or delusions. And one way that you can help if you are helping someone here is to record what's happening in a diary every day while the patient is hospitalized. Then the patient can read the diary, and this will help establish what actually happened. It's very easy to become delusional after anesthesia, and to believe that those delusions or paranoias are absolutely true. And so having a diary allows the patient to focus on what actually happened and not their frightening details of their misperceptions. Music therapy is an excellent, excellent way to prevent post-traumatic shock disorder in intensive care, or even outside of intensive care. If permitted, bring some earbuds and some music as soon as you can go into the person that you are helping, or if it's you and you're there alone, be sure your music is back at your bedside after you are taken out of intensive care or out of the surgical theater. About 12% of people who have a heart attack develop post-traumatic stress disorder, and they are much more likely to experience a second heart attack. Heart attack survivors frequently go into panic whenever they feel that their breath is short or that they think another heart attack is on the way. And of course, this creates a very vicious cycle of panic attack, which can be mistaken for a heart attack, which winds them in the hospital only to be told they're not actually having a heart attack. Motherwort is a wonderful thing to use as your ally because it can certainly relieve that. And cancer treatment is frequently followed by post-traumatic stress disorder. Or as one oncologist said, well, the treatment is not a walk in the park. And I said, that is a euphemism. People are traumatized by the treatment. And it is a rare oncologist who will really tell you beforehand how absolutely devastated you can be from cancer treatment. And I was very thrilled to read that they are recognizing the shock and the trauma that this creates in people. I've got Stephen Booner's book, Herbal Antibiotics, here. And this is the second edition. And Stephen tells us resistant bacteria caught my attention in 1991, and they've never let go. Because even worse than having post-traumatic stress disorder, because after all, if you have post-traumatic stress disorder, it means you've survived. Even worse is getting an antibiotic-resistant infection from what might have been considered a minor surgery and dying because of that infection. The data were clear back in 1991. We had a very limited time in which to alter our behavior if we wished antibiotics to remain part of our pharmaceutical options. And many people, including bacterial researchers and epidemiologists, knew exactly what was happening. But knowing it and being able to actually act on it, well, as we know, those are two different things. And it is astonishingly difficult for human beings to act on something when we can't actually see the problem. As a species, when it comes to the overuse of antibiotics, we have not altered our behavior to match what the researchers have been saying and finding and telling us for decades that we must do. Stop using antibiotics except when they are absolutely essential. That is to say, they should not be used except in situations where there is a possibility of death or disability if they are not used. And think about the last time you took antibiotics. Was it really a possibility of death? Or did a doctor offer you an antibiotic because you had a cold? How are we using antibiotics? The difficulties that face us now in the 21st century are dire. We cannot escape the emergence of pharmaceutically untreatable and very serious diseases that are resistant to antibiotic. These diseases are not limited to isolated individuals here and there, but are going to become widespread epidemics of tremendous virulence. And those epidemics will come not only from the resistant organisms that we know about, but from the viruses and bacteria that are emerging every single day more and more resistant to antibiotics. The growth curve is inexorable. The emergence of an antibiotic-resistant epidemic is only a matter of time. And I predict a short time at that. And when it comes, pharmaceutical antibiotics will be useless. That's why I have written this book. And he quotes Stephen Projon from Stephen Projon's book, Bacterial Resistance to Antimicrobials. In the late 1940s, the successes of streptomycin and tetracycline led us to believe that bacterial infections were conquered. That conceit led to widespread misuse and outright abuse of antibacterial agents. Nonetheless, we still neither fully understood nor appreciated that these antibacterial agents could cause resistant bacteria. Many important advances in the practice of medicine are at serious risk right now because we didn't understand this. Multi-drug resistant bacteria compromise our ability to perform what used to be considered routine surgical procedures. You may read the ubiquitous phrase in your obituaries, died from complications following surgery. But what is not well understood is that these complications, which may include blood clots and pneumonia, are more and more multi-drug resistant infections. And then Stephen gives us some real life scenes. Janine Thomas. In 2001, went for ankle surgery. You're just living a normal life, she says. You've never been sick. You've never been unhealthy. And all of a sudden, you're fighting. You're fighting for your life. It didn't just happen to me. It's happening to individuals on a daily basis now. I got MRSA, MRSA, from my surgery. It went to my bloodstream. It went to my bone marrow. It caused septic shock and organ failure. I had to undergo multiple surgeries, including a bone marrow transplant and a never-ending cycle of antibiotics in order to survive the ordeal. She began a Survivors of MRSA support group because she did indeed survive. Frank Collinson was admitted to the hospital following a fall in May of 2009. He stayed in the hospital for a few days, but there wasn't a lot that they could do for him because he had cracked ribs. When he left the hospital, it was noticed that he had a skin infection. 4 months later, he was dead. He, too, contracted MRSA. Astonishingly, no health professional told him that that's what was going on. They knew, and they were giving him a very, very strong antibiotic. His son said, I Googled the name of the drug they were giving him, and it was through that I discovered that he had MRSA. I went ballistic. How could they not tell my dad that he had an infection that could kill him? He did survive. Fiona Weatherstone and her 4 brothers were shocked when their 73-year-old mother, Sylvia Weatherstone, died in Lincoln County Hospital after being admitted for an injection to help relieve some pain. It was January when Mrs. Weatherstone was admitted for a nerve root injection to numb pain in her back caused by severe pressure on that nerve. The day after the injection, her health began to deteriorate, and soon it was obvious that she had some kind of infection. Test after test was taken, and it took days before Clostridium difficile was diagnosed. It did indeed kill her, although she spent a month in the hospital. And Stephen Booner says to us, the breeding ground of superbugs is the hospital and the doctor's office. Don't think, if you go into these places, that you are safe. Late in 1993, Sharon Begley reported for Newsweek. Infectious disease specialist Dr. Cynthia Gilbert entered the room of a long-term kidney patient, her face set in the mask that physicians have long used when coming to pass sentence on a patient. The man was not fooled. He took in at a glance. You're coming to tell me I'm dying, he said. She paused. There's nothing we can do. She took a deep breath. I'm sorry. Her patient was going to die of something that would have been curable just a year earlier. An enterococcal bacterial infection. But this bacteria was resistant to antibiotics. For 9 months, she had tried every antibiotic possible to help this man. But he, so weakened by his kidney disease, could not fight off a bacteria impervious to every pharmaceutical. He succumbed to massive infection that ran through his blood and took his heart. This inconceivable outcome is growing common. Millions of people contract resistant infections every year in the United States, and worldwide we are talking about hundreds of millions of people. Estimates of the dead and the maimed are rising year after year, and no one knows how to get out of it. Why is the toll mounting? Because the number of people infected by resistant bacteria is increasing. Why are the number of people infected by resistant bacteria increasing? Because everywhere that the ill, the old, the poor congregate, homeless shelters, inner cities, prisons, child care centers, hospitals, doctors' offices, there pathogenic bacteria congregate. The most dangerous place on earth right now is your average hospital. For there is no other place where bacteria get a chance to talk about all antibiotics. And they do. Bacteria can actually exchange DNA with each other. When a bacteria learns how to resist an antibiotic, and there are a great many different ways that they can resist antibiotics, they can not just tell other bacteria how to do it, they can give their DNA that has learned how to be antibiotic resistant to the other bacteria. Pretty scary stuff that we are all looking at. Wow. Again, this is why Stephen Booner has written this book. The period euphemistically called the age of miracle drugs is dead. In 1999, 54 years after the beginning of the commercial production of antibiotics, the first staph strain resistant to all known antibiotics had killed 3 people. Originally limited to hospitals, the primary breeding ground for staph infections, these strains have begun to appear outside hospitals. In 2002, I saw my first antibiotic-resistant staph infection outside a hospital setting. As I write, in 2011, every month brings an email or a call from someone with another antibiotic-resistant staph infection. The rate of resistance development was supposed to be impossible. Evolutionary biologists insisted that evolution in bacteria could only come from spontaneous, usable mutations that occur with an extremely low frequency. That bacteria could generate significant resistance to antibiotics in 35 years was considered impossible. That human species could face the end of antibiotic use after 60 years was ludicrous. But in fact, that is exactly what has happened. Michael Schmidt in Beyond Antibiotics said, the trend in bacterial development of antibiotic resistance is like the increasing resistance of agricultural pests to pesticides. In 1938, there were just 7 insects and mites that were resistant to pesticides. 50 years later, there were nearly 500 resistant to pesticides, and that included most of the world's major pests. In fact, pests have evolved sophisticated mechanisms for resisting the action of chemicals designed to kill them, much like bacteria have learned how to resist antibiotics. Stephen Booner's book, Herbal Antibiotics, continues the story of antibiotic resistance if you want to know more about it. But most importantly, he gives you real alternatives. Back when we were talking about drugs, we talked at length about some herbs that can be used. And the new edition of his book is rather fascinating because he talks about the herbs that he didn't include. He says after using garlic clinically for 20 years, he has decided that although it works really great in test tubes and in animals, it doesn't work very well in humans, and so he didn't include it as one of his herbal antibiotics. Oh, my goodness, so many things to think about. Well, we have come to the end of yet another show, and we are going to be wrapping the 7 medicines up in the coming weeks. I will pretty much recall to us everything that we have done and send you back to previous shows and tell you how other people have used the 7 medicines when they have had life-threatening situations. And so we'll wrap this up in the coming weeks. I look forward to being with you, Gemini. Thanks once again for offering me this opportunity to share green blessings with you and everybody else.
Thank you, Susan, and we look forward to the rest of the 7 medicines. And this concludes part 96 of our series, The 7 Medicines, The Wise Woman Way, with Susan Weed at Time Monk Radio.